Great. So we have three very distinguished experts for the next session, next part of this discussion. First up will be Dr. Preethi Malani. She is Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. And we've asked her to provide a patient perspective on disruptions in care associated with COVID-19, drawing on data from the National Poll on Healthy Aging that she directs.
So I just also wanted to thank everyone for having me. This is a real treat to be with a different audience and really a different venue. At my core, I'm a clinician. I'm a health services researcher, and the last 2 years I've been really thrown into becoming a public health emergency manager. So I'm really glad to be able to step back a bit and really think about health, not just in a reactive way, as we are around COVID in many cases. So a lot of the themes that Ipsita discussed really resonate with me, including health equity, innovation, and I'm going to really focus, as Murray said, on the patient perspective, which doesn't always get looked at. And I will be presenting some recent data from the National Poll on Healthy Aging, University of Michigan's National Poll on Healthy Aging. And the work out of the National Poll on Healthy Aging really grew out of that desire to hear the voice of the public and better understand the issues that are important in the day-to-day lives of older adults and their families. And there isn't time right now to go into the background on the poll, but I would love to refer everyone to healthyagingpoll.org, and I'm happy to pop that link in the chat in a moment. And again, all these reports are there for you to look at, and they're very user-friendly. But briefly, the National Poll on Healthy Aging is a recurring national household survey of US adults on issues related to health, healthcare, and health policy, affecting older adults and the people around them. And our audience is 50 to 80, so aging and pre-aging, and including a lot of caregivers. And I should just mention that our lead sponsors, in addition to the University of Michigan, is AARP, and they're a wonderful partner in this work. So again, I think the audience is well aware that older adults are of interest, and we just heard a lot about Medicare and Medicare Advantage. And older adults are going to, of course, consume a disproportionate amount of healthcare resources, including Medicare dollars. And this population is really vital to any discussion about the changing business of healthcare. So I'll take the next slide. And this is just a figure for you to really illustrate pandemic disruption. And many older adults had appointments on their calendars, sometimes for months, to see their doctor, their dentist, see a specialist, maybe even have an operation or procedure. And the pandemic was very disruptive for those things. Now, it was interesting hearing Ipsita's comments that, in some ways, maybe this is good for business, but from a clinical standpoint, I really think that some of this disruptive care is going to stay with us. If I can have the next slide, I'll show you some data, and these are very contemporary data from January of 2022. So really just a few weeks ago, and you can see here, and I'll go through a bit of this in detail, that the pandemic in 2021 disrupted plans for about 30% of older adults who had a scheduled appointment. And we don't have the data for 2020 from our poll, but it was probably a lot worse because clinics were really actually completely shut down for weeks on end. And I'm going to just start with some of these data. And again, many people still haven't gotten some of the preventive care that they should have gotten, and some of those issues may linger, but some specifics. So from dental appointments, 31% reported that they had a disruption in a dental appointment, 29% for primary care, and for procedures, tests, and operations, 28%. And of course, this includes cancer screenings. And I'm among this group of the 50 to 80-year-olds who had some things disrupted. And in fact, maybe after we're done today, I'm going to make some phone calls and try to get some of this rescheduled. The right column is sort of interesting, and like a national population of all people in that 50 to 80 age group, a large majority of our poll respondents said that they had been vaccinated, about 83%, and many had had their booster doses, and some were probably in process since this was just done a few weeks ago. But 23% of people 50 to 64 and 11% of those over 65 said they were not vaccinated. And again, just an interesting observation that the unvaccinated people we're also had a lower likelihood of having rescheduled disruptive care. And again, we don't know the reason. Is it access? Is it that they're essential workers, that they're not interested? Or is it mistrust? And I think, again, it's just something to be aware of, is that there's a pretty clear correlation between people not getting vaccinated and not necessarily getting this disrupted care. The next slide. I want to talk just briefly on the patient perspectives around telehealth. And we've heard about this topic, of course, today and earlier in this week. And, you know, when I think back to the initial surge in the US back in March of 2020, the health systems really had to make a rapid, largely unplanned, complete shift in sweeping shift in terms of how care is provided. And some of the changes at that moment were just all about stopping the spread of COVID. Nothing else really mattered. It was all about public health and really kind of getting people out of the healthcare system and keeping people home. And you know, this shift led to many patients, especially older adults, having to make appointments with their healthcare providers via telehealth. And you know, I have to say, as a clinician, if you had asked me even a few months before that, I couldn't have believed that care could have been provided in such a high quality, convenient format. And you know, this has really become something, you know, if among the opportunities, I won't say blessings or silver linings, because this has, you know, obviously been very tragic for so many people and families, but telehealth is one of the places where the progress that we have seen and that I've seen personally with my own patients has been just mind-boggling. And we actually polled on telehealth in May 2019. And at that point, it was sort of a futuristic idea. And again, you can see here that that things changed a lot between 2019 and 2020. And there was a very large change in the proportion of older adults who reported that their providers provided telehealth visits and that they had participated. So 4% in May of 2019, all the way to 26% in June of 2020. And those numbers have continued to increase. And I know, again, in my own family, this has become very standard for people. But if I could have the next slide, something that I think is useful for our audience today is concerns about telehealth visits. And again, some of this has probably been resolved as this becomes more familiar, but some of the things that were noted by older adults in June 2020 are shown here. One is that healthcare provider can't conduct a physical exam, 75%. 67% said the quality of care is not as good as in person. Other concerns noted, not feeling personally connected to healthcare provider, 45%. And, you know, again, I think that's something that affects all virtual things, including this conference today. It's just a little bit different. Having difficulty hearing or seeing the healthcare provider was something that 25% noted, and then privacy was 24%. And again, maybe some of the issues around privacy have improved, but difficulty seeing and hearing remains an issue. And I've seen this in my own family. So, you know, again, thinking about this, and then people don't always have a caregiver with them at a video visit because they may need to miss work, just like a regular appointment. I wanted to just make an issue around the equity piece around technology use and comfort. And we did an earlier poll on portal use, and only about half of older adults had portals. I think that number has increased as telehealth has increased. But again, when we think about who doesn't have a portal, it tends to be older people with more complex issues of lower income and lower education. And so having systems in place to help navigate that. And I think a lot of health systems have done this well, including my health system. And, you know, I would just say telehealth, it's here to stay. So it's important to continue tracking usage among older adults to really optimize that. If I could get the next slide. So mental health, I will just say that I think the pandemic has really been terrible for everyone, not just older adults. Isolation and loneliness have been record issues. We have polled on these issues around social isolation and loneliness, and not being able to engage in meaningful activities. And in January 2021, we asked 50 to 80-year-olds about their mental health and the effect of the pandemic. And people were reporting worse mental health. And again, there's a slide here that just shows a couple touch points, and I would, of course, encourage folks to look at the full report who are interested. And you can see here that 28% reported worse anxiety or worry, 19% worse sleep, and 19% worse depression. And again, this is on top of numbers that are already high. But the next slide, I think, really raises something that is useful for this audience, which is just the comfort discussing mental health. And 87% of the respondents reported that they were feeling comfortable, 53% very comfortable, and 34% somewhat comfortable talking about their mental health. And 19% said they had discussed mental health with their primary care provider, and 10% had seen a mental health professional. Now, those numbers are much lower than younger adults, but the needs may be different. I will say, and these data aren't on the slide, but something that we noted was that although 71% said they would not have any hesitation seeing a mental health professional, 29% said they were really unsure. And I think that is something, for the sake of time, we won't get into all the differences, but as we think about comprehensive care and emotional support and well-being, it's really important to think about people who maybe are not seeking care, either through stigma or access issues. And again, access remains very difficult in many places, but sort of baking it into the primary care visit is one way that a lot of people have made progress in this issue. Next slide, please. I just want to mention the emergency department. As much as people love their primary care providers, something that is a very difficult place for older adults and their families to navigate is the emergency department. And these data are from June of 2020. We did ask specifically about COVID, and for the sake of time, I won't get into it too much here, but overall, 23% of 50 to 64-year-olds had an emergency department visit, and 32% of the 65 to 80-year-olds, and this was in the past 2 years. So again, lots of different reasons, but one of the reasons, 1 in 8, 13% said they could not get an appointment, a timely appointment with primary care or a specialty appointment. And those with lower incomes were more likely to go to the emergency department. This is something that Medicaid programs pay a lot of attention to. And sometimes it's just that people couldn't take care of themselves at home and they end up coming to the emergency department. They need help with medications, medical supplies. Just in my personal life, one of my friends called me because her mother's in Florida and wasn't able to get access to important specialty care. And I said, I hate to tell you this, but I think you need to go to the emergency department because I don't know how to make this work. So it's not just people that have lower incomes. It's actually just people who are medically complex. And there were a number of concerns that people voiced, especially during the COVID pandemic. Visitation was limited. People were worried about exposure to COVID. I know we navigated this in my own family with an older adult in my family who needed emergency care, but and had very difficult time hearing, didn't speak English as their first language, and it was a very difficult situation to have her go to the emergency department. So again, I'd encourage folks to take a look at that as we try to improve those systems. If I could have the next slide. I want to touch base quickly on medications. Older adults, complex medications, many of them with multiple prescription and non-prescription medications. And it's interesting is that previous research has shown that it's not just high costs, but it's drug-drug interactions, it's the wrong doses, it's poor adherence. There are a number of issues among this group. And I want to make a plug for a comprehensive medication review. And we heard a little bit about Medicare. We heard a little bit about Medicare D. I mean, these are underused benefits. And that was the topic of this particular report. And we collaborated with a couple of our pharmacy colleagues who study this issue. And, these days with video visits being so prominent, it's easier to get this done for many people. But again, with these comprehensive medication reviews, they involve really reviewing all medications, how they're being taken, why they're being taken, side effects, drug interactions, costs. And, many people come out of those visits with fewer medications or with lower cost alternatives. And again, I think this is something that is very, very much underused. We can wait for legislative solutions to this issue, but this is something that is available. And I wanted to point out the data that are presented here in terms of the number of medications people take. I will say that 5 or more medications It's more common, not surprisingly, in the older group, 30% of 65 to 80-year-olds, and about 19% of 50 to 64-year-olds. And those individuals also are more likely to take non-prescription medications too. And you can see on the slide that only a small portion of those even taking 5 or more medications had had a comprehensive medication review. But our respondents were very interested in learning about this and about having these kind of reviews. So again, some of you who are benefits managers and dealing with health plans, this is something that can be offered. And if I can have the last slide, I'm just going to really quickly touch on this, and maybe we can get to this during the discussion. So I'm an infectious disease physician, and as I mentioned, spending a lot of my time talking about vaccines. And I'm just sharing this. This is from last year. So when vaccines were just coming out, I think we polled in October, if I remember correctly, and we asked about trusted sources for health information, and whether people, as people were thinking about getting vaccinated. And again, this predates vaccine being available, so that's an important limitation. But how well it works, 80%. Their own research, 56%. And as much as that sounds great, that is actually a marker for people who have mistrust. So again, when people are doing their own research, it is helpful for some things, but it may not be for others. Recommendation of their doctor remains important, and this has been something that has been very, very important in getting vaccination rates up, about 52%. Family and friends were also important, 13%. And again, I would be very interested to repeat this particular set of questions today. So I'm gonna end there and hand off to the next speaker. Thank you.